question answer session, and I hope people join in fast so that we waste no time. We have only half an hour's time today, so be very fast in answering questions. Yeah, welcome, Dr. Palak. So there was a question. There was an interesting case. Before I start the case, I hope people have joined in Instagram. We have people in YouTube. Yeah. Good afternoon, Dr. Smith. So there was an interesting case where the patient had a very interesting complaint. The whole case taking was done, and the patient had a very typical symptom that whenever I get up in the morning, or the wife said, whenever my husband gets up in the morning, there's a lot of anger, there's a lot of symptoms, there's a lot of headache, there's a lot of all symptoms are because of that. So in the whole case taking, if basically you have this symptom of morning aggravation or waking aggravation, that has to be differentiated very, very particularly. Ask the patient when he gets up in the afternoon, or when he sleeps in the maybe in the afternoon or forenoon sometimes, after waking also, does he get the same symptom? If the patient says yes, then you have to take the symptom waking aggravates. Waking aggravates. So this is very important. Whenever the patient wakes up from the sleep, it aggravates. So it becomes the whole personality of the case, the whole picture basically, or the whole picture of the disease of the patient basically is on waking. Don't always give one remedy which is very, very commonly prescribed, that is lachesis. Patient slips into aggravation, patient wakes up with aggravation. No. There are some remedies which are so very useful with this symptom of waking aggravates. If you see Boger's repertory, he has written a very interesting word that sleep, waking from after aggravates. That means whenever the patient wakes from the sleep, it aggravates the complaints. In the same way, there are other repertories, like if you see Fatak's repertory also, he writes also the same thing, wake aggravates. And there are beautiful remedies which you have never thought of. Lachesis is definitely there, but do think about Lycopodium, Nux vomica, Spongia, and sulfur. Very, very interesting remedies. If in whole case the patient comes and tells you one symptom which defines the patient personality, waking aggravates. Waking aggravates, that means all the complaint, the whole constitution is aggravated because of that. Think about Lycopodium, Nux vomica, Spongia, of course, lachesis and sulfur. And if the patient's subordinates or the associates tell, yes, when he wakes up in the morning, he is very angry. So whenever the patient wakes up angry in the morning, remember one remedy, very, very useful in my practice. I have never failed when I have used this symptom for prescription, that is Lycopodium. Calicarb is there, phosphorus is there, but Lycopodium, the patient wakes up in the morning with a lot of anger. And Lycopodium has never failed. Do write down in your Mater Medica. Welcome Dr. Pratibha, Dr. Almagir, Dr. Tejuk, Indranil, Vishaka, Kamal Sartaj. So this is a very, very important symptom, because I have cured lots of cases when there were a lot of maze of symptoms, lot of repeaters have done. But this symptom, the patient wakes up in the morning with anger, think about Lycopodium, think about Calicarb, or think about phosphorus also. Okay, so before I add few more cases, I have a question. So does CM virus can lead to, virus can lead to fertility, and that's why we do the torch test, that's why we do the torch test. So any virus can basically give you infertility. And whenever virus is the cause of infertility, virus comes in the body, or virus activity increases in the body because of low immunity. So simple as that, take a good case taking, because whenever virus attacks in the body, it is said that there is no medicine for virus. But virus is present in everybody, but the constitution immunity goes down and the virus symptom starts coming. So whenever the constitution is compromised, whenever there is a primary disease called cancer or XYZ, there is a lot of patients you will be seeing herpes zoster comes after he had cancer or during cancer. This is because of compromised immunity. The immunity has gone down. Take the whole case and prescribe the remedy, and you will get the remedy, right? In case of infertility also, yes, that's why the torch test is done. Okay. So this was I'm telling you about Lycopodium. Now, if you see Lycopodium, I've seen Lycopodium in practice. Apart from this, if you see Mater Medica, it is written that dry nose stopped up at night. The patient has to breathe through mouth. Why this is important? Because if your constitutional medicine actually matches with the acute, then that means that remedy, the chronic remedy, you don't have to worry, that will come out automatically. So whenever there is dryness or stopped up feeling, especially at night, and the patient has to breathe through nose, like ammonium carb, like Nux vomica, like Sambucus, that is Lycopodium. A very important remedy for snuffles. Children starts rubbing their nose, rubbing the nose, root of the nose, the frontal sinus. That is also Lycopodium. So whenever you find that the chronic remedy is very much indicated in acute complaint, that means you have got the constitutional remedy right of the patient. That's why I always tell you, whenever there is acute symptom, acute disease, take the case properly, because you will be attempting to crack the simillimum in that patient with that acute symptoms. That's why Lycopodium, as I have told you, anger, I have told you about nose. Welcome, Dr. Ashwini. I tell you, yeah, welcome, Dr. Kochar. And one thing about about Lycopodium is there's always, I've seen constipation since puberty. The patient says, when I got my first menses, that time I started my constipation, and now I'm 40 years of age, I still have the same problem of constipation. So if you get the entry point of the disease, the time, the remedy is Lycopodium. Or the patient comes and tells you, since my last confinement, after that everything is solved, but my constipation is still not solved. Or you can say constipation when is away from the home, that is also Lycopodium. So apart from the mental symptoms that we everybody know that Lycopodium is written that for persons who are intellectually keen but physically weak, the upper part of the body emaciated and all. These symptoms are there, but these symptoms of constipation, the symptoms of nose, you have to remember, because if you remember the acute symptoms of a chronic remedy and that fits the case, that means we have got the simillimum. This is the importance. This is, in fact, in Lycopodium it is written that the patient wakes up hungry feeling in the night, like Sina and Sorinum. That is also Lycopodium. So just I was telling you something about Lycopodium because it came in my mind. That's why angry when waking up, the constipation of Lycopodium, the nose symptoms of Lycopodium, and of course the symptoms of Lycopodium when he wakes up in the night feeling hungry. Think about Lycopodium, Sorinum and Sina. Okay, so these are the interesting remedies, interesting symptoms of the remedies that you should remember. Yeah, as we go further, you can start asking the questions so that I can answer it very fast. Otherwise, I'll give you some another case. Waking. That's why I wanted to tell you something about waking. Yeah, any other questions on Instagram? Some questions have been scrolled up. So if you could please write the question again, it will be better. Yes, on Instagram, there were questions. Okay, so there are questions. Now, it is not always that you take the, see, Boger repeated, he's given everything in generalized pattern. But it is said that whenever the patient wakes up angry, think about Lycopodium. Whenever the patient wakes delirious or delirium when waking on, think about hyoscyamus. It is such simple as that. Normally, we think about hyoscyamus, about mania and different types of mania, hyoscyamus, stramonium, and belladonna, and try comparing. Sometimes when you fail in your prescription, do take this symptom. Whenever the patient wakes up with the delirium, think about hyoscyamus. These are very, very important entry points of the remedy that we have to remember to select or to get into the polychrist remedies. Like for instance, there are some patients who wake up and say, when I wake up in the morning, from sleep, my mouth is absolutely dry. Because of the dryness of mouth, the patient wakes up from sleep. There may be a lot of remedies, but one remedy that has given me very, very good results. Can you guess that remedy? Because of dryness of the mouth, the patient wakes up from sleep. Anybody? Which is that remedy? Yes? Normally you ask questions. Sometimes I may also ask questions. No? So whenever because of dryness of the mouth, the patient gets up from the sleep. The remedy is Dr. Tejuk says bryonia. Okay. Any other remedy that comes to your mind? I'll discuss one of the very interesting case I had. Nux moscati. Nux moscati is dryness whether the patient wakes or does not wake. Anything else but nice, the good remedy. Anything else? Nux moscata is there, Dr. Ashwin Jain. It is there. Of course, there are a lot many of remedies, but I just remember a case where the patient was suffering from sleep apnea. And in sleep apnea, the dryness is a very, very common symptom because when the patient sleeps with open mouth and there is a lot of dryness. And of course, I had given 2 or 3 remedies which worked partially but did not cure the case. And then the patient told that the mouth becomes so dry that I have to wake up because of that. And then I prescribed the remedy cinnaberries. Cinnaberries is the only remedy I have seen that because of so much dryness in the mouth, it wakes up the patient. And I prescribed cinnaberries 200 to that patient, and the sleep apnea was taken care of. See, we are here not discussing only dryness of mouth on waking in the morning. We are basically discussing dryness of mouth which wakes the patient from sleep. Dryness of mouth in the morning when the patient wakes up, the remedy, there are a lot of remedies. Lycopodium is there, phosphorus is there, rustox is there, Paris quadrifolia is there, lots of remedies there. But the mouth is so dry, it wakes up the patient. Whether it is night, whether it is morning, whether it is afternoon, the remedy is cinnaberries. So if you're treating a case of sleep apnea, do think about this symptom because this remedy has helped me so much in my practice, especially in cases of sleep apnea. Now, cinnaberries, if I could go further and add something about cinnaberries, it is basically called as mercury sulfide rubrum, merc sulfide rub. It has a very, very important symptom in relation to eyes. Normally when there's red eyes, you normally think about a lot of other remedies, but never cinnaberries. Redness of the whole eye is a very, very important symptom of cinnaberries. And it is written in the throat symptoms of cinnaberries that the mouth and the throat are so dry that the patient has to rinse the mouth. It is that dry. And because of that, sometimes there are a lot of ulcerations, fiery looking ulceration in the mouth and throat, and that is cinnaberries. Of course, I'll not talk in detail about cinnaberries because it will take the whole half an hour. So we have a question. I think again I've scrolled up. Guilty feeling from masturbation, seminal emission, easy and not satisfied with sex, not gaining weight. No, whenever you have that guilty conscience, now whenever you feel that I've done something wrong and not performing sex because of that, of course, the remedy that comes in everybody's mind that should be okay, phosphoric acid. But if you have anxiety of conscience that you feel okay, I have done a mistake and because of that so there is a lot of anxiety of conscience, and in that there are so many remedies. Don't always think about acid force or staphylos aureus. These of course are very, very interesting remedies, very, very routinely prescribed remedies, but try to get the whole picture, anxiety of conscience, and match the SORA, whether this anxiety of conscience the patient had in his past in SORA, and that becomes a very, very important prescribing symptoms of that patient. So anxiety of conscience, you have remedies like aurum metallicum, alumina, arsenic, soranum, chelidonium. Phosphoric acid is definitely there, but these are a lot of other remedies also. And you can always use the rubric elements from masturbation, and you have remedies of all that acid, phosphorus, agnes, cas, dam, a lot of remedies. But in this case, it has hurt the patient. And if you see that symptom anxiety of conscience after masturbation, if you want to be very specific in your symptoms and defining the symptoms, then only one remedy you should think about, that is phosphoric acid. Okay, Dr. Pratibha. So, yeah, so I'll take a question from YouTube. Can we think of Kali Bichrome, Chinninum Sulf, and Colocynth also sleep? Yeah, yeah. There are remedies, dryness of mouth with sleep. There are a lot of. That's why I was telling you that dryness basically of mouth, there may be a lot of remedies. But now I was just telling you symptoms like the mouth is so dry that the patient has to wake up because of that dryness. Apart from that, see, there are dryness of mouth in sleep, and sometimes it is not. I'll tell you one case where the patient told me that the mouth is so dry that I cannot sleep. That I cannot sleep. And the remedy which I prescribed to that patient is very interesting, Kalikarp. So I was just trying to define that symptom. Of course, dryness of mouth in general would be hundreds of remedies, but these remedies will also be there. Of course, Chinninum Sulf I have never prescribed for this symptom because it's a rare remedy. Kali Bichrome I have, Colocynth also I have not prescribed. So dryness of mouth, preventing sleep, Kalikarp, and after the patient is sleeping and the patient gets up because of dryness, Cinnaberis. So, and one question was asked, yeah, phosphoric acid. Anxiety of conscience after masturbation, one remedy, that is phosphoric acid. So, in acutes, many patients feels hot and chilly alternate many times. Which rubric should we take? No, if you find that difficulty in understanding that the patient is changing the states, don't take that rubric. If you feel the changeability in states, there's otherwise, don't only prescribe on that symptom of changeability, because there are a lot of alternating states. You can think about the alternating states, but if you just want to prescribe on those symptoms, don't prescribe, because it depends on the patient's perception, and actually whether the patient is suffering from not an from that complaints. So if I was given a chance, remedies are there, pulsatilla is there, naxomic is there, china is there, china is there, arsenic is there, lot of remedies there. But don't prescribe on that symptom, because you might fail in that. Okay. Okay, excessive jealousy with compulsion to control and fear of loss due to lack of self confidence, suffering, unhappy love. Okay, everything in the patient is, I think, all negative. Excessive jealousy with compulsion to control and fear of loss due to lack of confidence, suffering, unhappy. Now, whenever you are facing a case, whenever we are facing a case that the patient is jealous, that means you are basically taking the psychotic symptom. So whenever you are taking a psychotic symptom, be very sure that your symptoms are taken rightly, because psychosis is all facade. You cannot see the other side of the person. So prescribing only on psychotic symptom would be a bit risky. So add to that few more symptoms in jealousy. Jealousy sometimes become a common symptoms during career, or from the age between maybe 25 to 40, because it's a career age. So it's important to understand other symptoms, either psoriatic symptoms or syphilitic symptoms. Then you will be able to prescribe on this symptom of jealousy. Okay. 35 years, yellow eyes, no symptom, but sunlight makes eyes red. Now see, there will be a lot of cases, where the patient comes and tells you that the eyes are red, especially going on sunlight. Now, if you see, there are so many remedies where the discoloration is red. Now, if you have added one more rubric to your case, that maybe in the sunlight. Now, sunlight also sometimes, that depends on the patient's personality, how the patient is there. The what do you call, delicate personalities normally suffer from these complaints, delicate personalities. But classical, when the patient tells you that sunlight, going in sunlight, or the eyes are red, you have remedies like belladonna, gluonine, natrum, urantium, crude, euphrasia, brata, pulsatilla, opium, so what you call Apis mellifica. These are very, very common remedies. But what remedies which I have seen in my practice really works well would be natrum mure, antim crude, naxomica, and arsenic. Have given me very good results. Sir, please tell about gallstones. I used all medicines: Chilidonium, Calcarea carp, Chionanthus, Caradasmar, Filtauri, Colestrinum. Now, what I should do? All stones size of only 5.6 millimeters. See, if you have prescribed all the acute remedies, all the so-called specific remedy, and still you find that the medicine is not working, make sure that you have to take a constitutional prescription. Otherwise, there is no other way out. You have to prescribe constitutionally. Okay, because you have exhausted all the remedies. Few remedies you can add. Berberis vulgaris is one is there. You can also try it, but I don't think it will work in this case. You have to go for a constitutional prescription. Dr. Ashwin Jain says, in morning hours always coryza occurred, and whenever cough cold happens, it will take time to recover. Yeah, so what happens in the morning, cough coryzas in lot of psoriatic cases is very, very common. The patient coughs in the morning, or everything is there in the morning. So if you are only taking symptoms to cure what you call the coryza, it would not be advisable, because the whole constitution is not aggravated in the morning, no. So you'll be treating only the coryza part of the patient. As I told you in the first instance, that waking up aggravates. The whole constitution must have that symptom. So don't only try to cure that cough cold coryza because it is in the morning. I can give you some of the remedies of the remedies which have classical aggravation in the morning. Remember ammonium mure, aurum metallicum, calcarea carb, naxomica, phosphorus, and rustox have classical aggravation in the morning. Maybe any complaints. So this morning aggravation, or ammonium mure, antimtat, aurum metallicum, calcarea carb, rustox, phosphorus, naxomica, lachesis, these all have aggravation in the morning. So take a generalized symptom rather than only taking symptom of coryza, so that it will help the patient better. Medicine for hirsutism, it is basically a costly problem, especially a problem of PCOS. So you have to take a very interesting and long case. You just told about waking up with anger. What about if a person is filled with anger every day without a reason? Then basically, if you Dr. Smith has got a very good a question. Now we were only talking about symptoms basically which are in the morning. Now she has basically what do you call ask the question where the patient is always angry. He is always angry and does not know when he's angry. If you have these type of complaints, of course, I always say that there is always a cause for something. There might be some cause which basically is provoking the patient, but it has become so prolonged that the patient feels it's part of the body. So whenever there is anger, prolonged anger without cause, think about remedies like carcinosin, chilidonium, hydrogen, miserinum. These remedies have anger, what you call causeless and prolonged. Pimples only when going outside in sun, and eruptions reduced when coming back to room. What can we think here? Cadmium cell works here. Yeah. See, whenever the patient says there's a problem outside, so we have lot of remedies. We have brownia, we have Asteria rubens, we have calcarea carb, we have pulsatilla, we have sepia. Cadmium sulfate is also there, but I would not prescribe on that symptom going out and coming in, because the patient might be very sensitive to dust, to cold, to air, whatever is going out. So treat that sensitivity part first to cure that case. Otherwise, you cure pimple and something else starts. At least the body is showing that sensitivity only in the form of psora. You suppress that psora and the patient goes out and says, now I develop asthma, or now I develop back pain or stomach ache. So you have suppressed that simple pimple into a different miasm and going inside the body. So if you take that symptom, I think you'll be only treating that pimple part and not the whole constitution. That's the problem in this case. So take the whole case. Sir, do we suggest some medicines for asthma in acute stage to relieve the patient in short time? Yeah. In asthma, whether it is short or long, there is no problem. Remember one thing, whenever the patient has asthma, just ask the patient, whenever you have asthma, what do you do or what happens in the body? And the patient says, when there's asthma, I wake up my wife or I wake up my husband because I feel that she has to get up. Okay. Whenever asthma, I don't wake up my wife or my husband, and I get out from the bed, and I make sure that my wife does not get up or my husband does not get up. I don't want to disturb her, and then I go out. Or whenever there's asthmatic attack, basically I have a lot of perspiration. Or whenever there's asthmatic attack, I have to go for a lot of urination. Or when I have asthmatic attack, I first go and open all the doors and windows. So when you ask these type of symptoms to the patient, exactly what do you do at the time of asthma, one dose of the indicated medicine, that symptomatic medicine, would relieve the case and give some breathing time for the patient also and to you also to prescribe a polycrystal remedy. I hope you understood, Dr. Indranil, na? Yeah. And you will have these type of cases fairly common in your practice. As you get up, the patient says that I yesterday, the in the night I got very asthmatic because just before going to sleep, I just scolded my. I was so angry because my child did not get good marks, and the remedy becomes chamomile and arsenic. And the patient says next day morning, I have a important meeting to attend, so I in the night I was feeling very asthmatic. So asthma from anxiety or asthma with anxiety, argentum nitricum. And the patient says that what you call see, you understood that, no? So there are a lot of there are a lot of symptoms, there are a lot of symptoms which basically you can think. Or the patient says that just because my house was dusted before during a festival, and because of the dust I am feeling asthmatic. So we have arsenic, calcare, hypersulf, and silicia. Or maybe the patient says that I heard something very emotional news about my parents, brother, sister, and I'm feeling mera dil bhar ke aa gaya, I'm feeling asthmatic. So you have remedies like coffee, gilsemium, ignitia, and aconite. So you have to basically ask at that time what is happening, and automatically that mater medica, the knowledge of mater medica, will help you to prescribe the remedy. I hope you understood the examples, Dr. Indranil. Though I'm very fast, I hope you all understand what I want to speak, because if I need to answer a lot of questions, so I have to be a bit fast. I hope there is no problem. Everybody is understanding what I am telling you. Symptoms of asthma, when aggravation, the remedies. Everybody, if you are understanding, you can write yes. Otherwise, I have to be slow. Everybody, nobody, no answer. Yes. Okay. Fine. Fine. So, so in asthma, it is very important also to ask this symptom, because if you can give good relief to the asthmatic patient, he feels as if the life has come back. It is such a horrifying feeling. You cannot breathe, and then you have to go and sit somewhere outside. It's a feeling of death trap. And when that one dose of a magic pill helps him, and he becomes a fan of it, the faith that develops, and automatically your practice goes. So be very alert in treating acute cases, acute cough, cold, chorus, asthma. Though it looks, oh, you can't treat cough, cold also, but it is very important for us to treat this acute cough, cold, chorus, and asthma. That's why go home and keep reading. Keep reading. If your mathematics increases symptomatically, automatic, you give time to yourself to prescribe the constitutional medicine. Yeah, very very nice. I think everybody's understanding. Do we have some questions more? I can go on and on in asthma. There are a lot of permutation combination, because when I close my eyes and think about asthma of my patient, then all symptoms basically come to my mind. Asthma from hives, humid asthma, hysterical, and all. There are a lot of other complaints, or you have asthma where kidney elements are involved. So we have some other remedies. That's also important. So any more questions? Or I think most of the questions have been scrolled up on Insta, also on YouTube also. You can always write the questions. Yes, anyone? So there was an interesting case where the patient was suffering from asthma and he had jaundice. He said, my asthma was cured, nothing, no symptoms. I am eating, drinking everything, but I have jaundice. The doctor says mild jaundice, and my asthma has started. Which remedy were prescribed to that patient, and he got cured. Anybody? I prescribed that patient a single dose of Cardus Mar. Very interesting remedy, Cardus marinum. And the patient was better with that symptom. The symptom which I took was asthma with liver complaints. So this is how symptoms and how the patient's PQRS peculiar symptom will guide you to the remedy. The patient will speak the remedy by itself. The symptom, as Dr. Hahnemann says, the only guide for a physician is the signs and symptoms. If you understand the signs and symptoms properly, you'll be able to understand and prescribe very clearly to the patient. Here, Dr. Indran, that was Cardus Mar, which I just told you. The remedy is Cardus Mar. So I think all questions answered till now, or something is remaining. I prescribed the patient Cardus marinus. It is called as, I think, milk thistle. It's a liver tonic, but it's an important remedy where asthma is because of liver complaints. If you go and see Cardus Mar, it is basically the remedy for all type of liver complaints, liver. But there are, of course, some rare symptoms of Cardus marinus. You must remember that is there is always a bitter taste in the mouth and aversion to salted meat. It is said that's Cardus Mar. So I think everybody has all questions are answered, I feel. Okay, so it's already half an hour up, and thank you very much for joining, and thank you for your time. I hope you enjoyed as much as I enjoyed answering your questions. Thank you so much.